Hello, I'm Dr. SudeepKoshy, Kurien, Interventional Cardiologist. What is a coronary artery disease? A coronary artery disease happens when there is a blockage of vessels supplying the wall of the heart. So when you walk, you have exertional chest pain or angina. If it is significant, you won't be able to do even regular activities every day. So then what you do is you do a coronary angiogram and diagnose it. Usually you do a treadmill test to confirm the diagnosis if the angina is not too severe. And if the treadmill test is positive, it shows ECG changes. Or if the angina is very significant, that means you cannot even do your daily activities, you have to do a coronary angiogram. A coronary angiogram is when you insert a catheter through your radial artery in your hand or femoral artery in your leg. So the catheter is passed through the artery and reaches the heart, and it hooks the left coronary artery, that is a left main coronary artery, and it divides into the left antedescending artery and the left circumflex artery. And the right coronary artery continues as the PDA and the PLV branches in most of the people. And if there is a significant block, that means more than 70 to 80% block in one of the major arteries, then you need to remove it via angioplasty and stenting. In case you have a heart attack where an artery is completely blocked off also, you will have to do an angiogram followed by a primary angioplasty where you open up the arteries, the occluded arteries, and thus save the dying muscle. If it's only an angiogram, it's hardly a 5-minute or maximum 10-minute procedure usually. And you take out the catheter and then you bandage the hand. And if it's a leg, you'll have to compress for some time. Otherwise, you put a compression bandage on your hand and you can leave the same day and you can remove the bandage the next day. There is also a procedure called CT coronary angiogram where you don't pass the catheter, but just like a CT scan, you inject a dye and you see the coronary artery without passing the catheter. So that is called CT coronary angiogram. Both are relatively safe procedures, and in people who are indicated, it helps us in diagnosing coronary artery disease and suggesting further measures.